So you took part in Let's Get Real with AI debate. What perspectives did you bring along in the discussion?
So AI is hyping. So there is always that question on what's real and what's not. If you remember, over the past years, we've heard things like blockchain technologies. Of course, I'm comparing them or just mentioning this from a technology standpoint. Blockchain, metaverse, hypes were good technologies that everybody talks about, and then it fades away and something else takes the scene. And that's AI now. So the question was really around what is real with AI versus what is not. But not from a theoretical standpoint, but from a clinical standpoint. So we had different panelists. I would draw a triangle to represent the panelists. At one corner we have clinicians, hospital managers and clinicians. At the other corner we have policymakers. At the third corner we have researchers and people who actually build AI data sets and AI algorithms that can actually produce the outcomes clinicians need, and regulators who can put the ecosystem for this to produce proper outcomes. And I think there were three cornerstones for the discussion. The first was what is real and what's not, what is over-exaggerated versus what is practical. The second element was around the ethical and, I wouldn't say legal, but I would say ethical and accepted practice of AI within a clinical setup for the physician and for patients, whether physicians who over-rely on AI to an extent that they may be not driving the patient relationship or not owning the clinical outcome, versus patients who I would like to call super patients, who come into the clinic, who have possibly treated themselves before or attempted to treat themselves before, read a lot about their situation, played multiple roles, checked how you treat their cases in the US, in Europe, in Southeast Asia, and maybe in the Middle East, and start debating with physicians based on this knowledge. The debate it wasn't really a debate, but the discussion was mostly around how do you manage such a complex ecosystem from the clinician's standpoint. How can policymakers make this relationship or this experience controlled in a way that is aligned with clinical best practices and best models of care? And how can researchers, being the ones who are fueling this journey, produce better solutions, solutions that are less likely going to harm patients, especially when it comes to their health? And how can this dialogue be running on a continuous basis?
What are the most common misconceptions organizations in healthcare have about AI's current capabilities versus its future potential?
I believe it's a supply-demand issue. I believe there is a lot of promise in the market and a lot of jargon around AI versus very little clear outcomes that can actually be used on a daily basis to produce a result. In a hospital or in a healthcare setup, we always often look at two things. We look at patient outcomes and we look at value-based care or value outcomes. Patient outcomes mean, for example, how can the patient journey, or let's take a diabetic patient, how can a patient journey be reduced, made easier, not be there at all using AI? If we spend more to achieve that, and eventually economically we can prove that AI has actually contributed to reducing patient outcomes or having better patient outcomes, this is a great success. And we are yet to see examples. I will give you an example at the end, but we are yet to see more examples in that area. The second element is the cost of care. How can AI help you reduce cost of care? Example on elderly patients who require remote monitoring, for example. In our populations, in the world today in general, people or countries brag about the life expectancy increase. That now people live in Japan for, I'm not sure how many years, 85 plus years, maybe 90 years. Yeah, but that means something. That means there is more care, there is more people in the healthcare ecosystem that require care. So more solutions are coming up to monitor those patients remotely. AI is playing a massive role in early detection because the further you are from a hospital, the quicker we need to respond in case you have an emergency. That puts a load on the system, but can be mitigated with AI, that instead of 10 false alarms, you can get 2 false alarms. And that eventually reduces burden on healthcare. And this is just a simple example. So these are the two things that we are yet to see more of. And to one of the panels, Dr. Ziad mentioned a very nice point that we are yet to have longitudinal studies that show the actual result of the impact of AI on similar points. The example I wanted to share was an example from a company called Amplify, and I believe they are here today. Amplify is a Saudi, I'm not sure if you've heard of them. Amplify is a Saudi startup in the field of AI, and they utilized AI algorithms to predict diabetic foot and prevent amputations early on. And this is a great example and very simple example and use of AI. When you look at it, really, it's a pure AI implementation. You've got the technology, you've got the algorithms, all you need to do is predict. So it's a combination of two things. It's a combination of training the algorithm and creating data sets that represents our reality. The second most critical point is access. How do you actually have these tools available at the points where the potential amputees, diabetic amputees, are available? Be it malls, clinics, homes. How do you reach that population and actually take them through that journey of early detection? And that's where policy comes into play. It's an ever-evolving ecosystem, and when this comes up, policy would evolve to make it possible and make other solutions possible. So it's always a race between the advancements of science and the advancements of policy and research, of course.
Right. Now, AI adoption in healthcare, it normally often stalls at the pilot stage. Now, what do you see are the main barriers preventing projects from scaling successfully?
It's important to mention that I'm not an AI expert. I'm a health systems expert.
Right.
When I look at AI, I look at it as a tool, like any other tool that can help me achieve results. I think one of the major barriers for scaling is the outcome and results. Second would be the infrastructure that is still evolving. When we look at AI, an AI solution being implemented in a healthcare ecosystem, we're looking at an infrastructure that needs to be solid against cyber attacks, maintains patient privacy, used ethically, doesn't put or puts reduced risk on users on both ends, physicians, hospitals, and patients. One missed case, because let's say we were just discussing now that there is in Poland there was around 1,400 colonoscopy scans that were done, and it was observed that because of the over-reliance on AI, there has been a 6% reduction in the diagnosis of possible cancers. Where do you draw the ethical line here? So I think there is still some skepticism in adoption, in the full adoption of such solutions, especially by clinicians. If you sit with an orthopedic who looks at X-rays hundreds of times every day, they could definitely use AI, but you would see the skepticism yet, even though radiology is one of the most advanced areas in AI detections because of the availability of comparable data sets where you can compare anomalies or abnormalities with normal scans. So that's one point. The second point would be cost. Like anything else at the beginning, cost is high, and no enough economic studies were done to prove what we mentioned earlier around these solutions producing less cost on the healthcare ecosystem. And third would be the policy. The policies are still evolving in a way that helps AI solutions work, at the same time maintains the clinical nature and the responsibility that should come with it, yet make it attractive for investors to come in and want to pour money and pour investments in that ecosystem and wait for results.
Okay. Lastly, now looking beyond the hype, if you can just give me some practical real-world use cases of AI, do you think is will have the most immediate impact on patients' outcomes and healthcare efficiency in the Middle East region?
I will borrow the example that was just
Right.
mentioned today. And the reason I will borrow that, it's a very real example, and this is what I really like about conferences like this, that it brings the reality and not just what you see on media. Dr. Ammar from Al-Amal Psychiatry Hospital mentioned a very nice example where they train AI algorithms on your memories and on your childhood memories, and with the extensive learning of that tool, AI tool, patients start seeing images from their history when they were children, things that they have forgotten, and how this can be very enriching and enlightening for patients who need to any source of hope to cling to. And I think that was a beautiful example, both on the medical side and on the emotional and human side as well. And I think this is really where tools like AI can bring tangible value to patients.